So the next item is hormonal control. The hormonal control is also used in order to influence the blood pressure. So either it can increase or decrease the blood pressure according to the body needs. The first one that we have is angiotensin II. Angiotensin II is going to produce vasoconstriction, and because of the vasoconstriction, then our blood pressure will increase. Aldosterone, the main job of the aldosterone is to reabsorb sodium, and because aldosterone reabsorbs sodium, water will follow due to osmosis, and since water follows, it will increase the blood pressure because obviously water will increase the amount of fluid in the blood. The next item would be natriuretic peptides. The most important one out of this is the atrial natriuretic peptide. Obviously, atrial sounds like atrium because this is produced by your heart, more specifically the atrium. So when there is too much pressure, this increased pressure will hit the heart with force, in particular the right atrium, because that's where the blood returns. So in order to avoid that, the atrial natriuretic peptide will reduce the blood pressure by stimulating the excretion or removal of sodium through the kidneys. And since you remove sodium, then obviously water will be removed as well. It basically has the opposite effect as aldosterone. The next one is anti-diuretic hormone. Diuresis means to urinate. Therefore, anti-diuretic means anti-urination. So that means that if you don't urinate, you will retain water. And if you retain water, then obviously the blood pressure will increase. The next one is epinephrine and norepinephrine. These two hormones, they are going to stimulate vasoconstriction, and because of vasoconstriction, the blood pressure will increase as well. So after that, we have purposes of vasoreflexes. According to your body needs, vasoconstriction and vasodilation will happen. If you are eating, then a lot of blood will go into your digestive system in order to help you digest the food. If you are playing, in this case, soccer or any other physical activity, then the blood flow will move from your digestive system into the muscles to provide them with enough blood in order to perform the action that they need to perform. Let's keep scrolling down. This is differences in blood flow. The next topic is capillary exchange. The main job of the capillaries is to allow the exchange of nutrients and waste that needs to be removed from the cells, and the nutrients that need to go from the blood into your cells. And this happens mainly at the level of the capillaries. So if we scroll down, main processes by which the substances can come out your red blood cells into the cells that you have in your tissues, or vice versa, from your tissues into your blood, they're going to be the filtration pores, transcytosis, in which the endothelium, the cells that you have in your capillaries, will capture some molecules and then they will be released on the other side. Obviously, diffusion is a very important process, right, as well as allowing of substances to pass through intercellular clefts. So those are the main concepts. Diffusion, obviously, we already mentioned this several times, especially in Anatomy 1. Diffusion is the movement of molecules from high concentration to low concentration. Transcytosis already explained. Endothelial cells will pick up material on one side and they will transport that to the other side of the endothelium in order to be released. Filtration or reabsorption. Filtration happens because there is difference in pressure. So right here you have the capillaries. In this case, in the area where you have the arteriole, you're going to have more forces coming out than the forces coming in. Therefore, this will force, for example, the gases to come out into your tissues, and your tissues will receive the oxygen which is necessary in order for the cell to perform the job every day. At the level of the venule, you're going to have more forces going in, 20, than the ones that are going out. Therefore, this allows, for example, waste to go from your tissues into the blood that you have, the venules, in order to get rid of them at the level of your lungs. So this is very important because, again, the gas exchange and the nutrient exchange and all the things that need to be exchanged between your tissues and your blood happens at this level due to the fact that we have these different forces. If we keep scrolling down, we go right here where you see the colloid osmotic pressure. As I said, is the one that pushes the things basically from your cells into the blood. And right here you have the net filtration pressure, which is the one that pushes the things from your blood into your tissues. In here, showing you the forces, right, the total amounts of forces that will help you with this exchange that happens at the level of the capillaries. You don't need to know these values. So if we keep scrolling down, we said variations in capillary filtration and reabsorption. Obviously, there's always going to be variations because we are always having different physical activities and different metabolic needs, and because of that, the filtration and reabsorption at the level of the capillaries must be adjusted. So if we keep scrolling down, edema is not something normal, right? That's the accumulation of excess fluid in a tissue, but you don't need to know that because that's not normal. Next topic, venous return and circulatory shock. Obviously, circulatory shock is not normal, so then that's not anatomy or physiology. So we're not going to talk much about it, but we need to talk about venous return, which is the amount of blood that returns into your heart. So obviously in here you have some history, how this was tested before. That's just history. Mechanisms of venous return. What causes your blood to return to your heart? Well, the very first one is the pressure gradient produced by your heart, right? Your heart pumps with certain force, and that's enough in order for the blood to come back into your heart. Gravity helps you to push the blood from your brain and your neck into your heart, right? So there's not much that you need to do in there because gravity will do that job for you. At the level of the legs and your feet, for example, now you don't have the gravity to help you pushing the blood into your heart. So then you will use the skeletal muscle pump. Skeletal muscle pump is the muscles that you have at the level of your legs that every single time they contract because you are walking, they will produce pressure in your veins, and your veins, together with the valves that you have in there, will help the blood to return back into your heart. The next one that we have is the thoracic pump or respiratory pump. Every single time you breathe, the pressure in your thoracic cavity will decrease and the pressure in your abdomen will increase. Because this happens and there's an increase in pressure in your abdomen, this will help you push the blood towards your heart. Cardiac suction. During the ventricular systole, the valves will be sucked into the ventricle. Therefore, this will increase the area in your atrium, therefore producing a force that it appears to suck the blood towards your heart. That's why it says in here, goes downward and creates a slight suction that draws blood into your atriums. Venous return and physical activity. Any kind of physical activity, the blood will return faster because obviously the heart will pump faster and all the activities in your body will increase. Venous pooling, that happens when you accumulate blood in your legs. For example, when you are sitting down for a long period of time, or when you are laying down in your bed and you don't move your legs, then that's when that happens. So if we keep scrolling down, we have circulatory shock. As I said, I'm not going to talk about it. Next topic is special circulatory routes. The brain, it must have blood all the time because the moment that you don't have blood in your brain, right, you're going to pass out. And if it goes more than that, like maybe 4 or 5 minutes, then obviously there's going to be damage to your brain and you will never going to be the same. Skeletal muscles, obviously the muscles are going to get a lot of blood when you have physical activity. The lungs are the only areas in which the artery contains a whole bunch of carbon dioxide, and the veins contain a lot of oxygen, which is completely opposite to what happens in your circulatory system. Next topic, anatomy of the pulmonary circuit. I think I already spoke about it a lot when we were covering the heart, right? We were saying that we have a pulmonary trunk, 2 pulmonary arteries, and then you have 4 pulmonary veins, 2 from the right side, 2 from the left side. That's about it.